Afternoon, at least if you're in the States. Today we're going to talk about bird feet, and I say it's the forgotten body part because it's the one part that, we don't see commonly. You pay attention to the beak and to the feathers, but sometimes the feet can be a little bit hidden unless there's an issue. It's said that when the eyes are a window to the soul, I think the feet are, and I also probably the feathers and the beak are a window into bird health and function. So I think as a veterinarian, they're so important to see, not only is the anatomy normal, but also, subtle things like scale health and good mobility, I think, is important for wellness exam on our side. But I think all of that starts with you guys. It starts at home. So we're gonna talk for the next hour. I'd love for this to be interactive. So if you have questions along the way, let Ann know in the chat, and we can answer those along the way. So a little bit about me. So I am a practitioner in Knoxville, Tennessee. I do a little bit of everything, mostly exotics, a lot of birds, dogs, cats, exotics, primarily, but then I'm also a veterinarian for a colony of penguins. Do some work with a group of raptors near me. So you'll see bird feet from kind of all over the place. So I'm going to highlight not only parrots, but also show you some examples of different species, because all in all, birds are cool, and a lot of the anatomical differences are really neat. So I do also put my little friend at the bottom here of the screen. His name's Rhaegar, at the bottom of the screen, because I want to mention too that, if you have any experience with reptiles, we pay a lot of attention in reptiles about scale health, scale quality, and then how the environment interacts with that. So optimizing husbandry to make sure our scales are healthy. So birds are the same, a lot of the things that reptiles need for scale health, the same as our bird feed. But again, because it's not the primary thing you see, I think our feet are forgotten sometimes. So we're going to go through anatomy and function of the feet. We're going to go through captive care and diseases, and today is going to be the tip of the iceberg. So if you want more in-depth information about specific anatomy, or you have questions about care issues or diseases, then I'm happy to chat after the talk, or I can direct you to some resources. Here we go. So in general, as you know, birds are bipedal, which means they walk on 2 feet just like we do. So when it comes to function, the feet are so important because all of their body weight is resting on 2 feet rather than 4 feet for some of our other species. Typically, most birds have 4 toes, but there's a huge variation in an arrangement of the toes based on function. So parrots are zygodactyl, which is important for climbing and mobility and good foot use. And I'll show you what that means in just a minute. And we number them from the inside to the outside. So we go from 1, 2, 3, 4 in most of our birds, no matter what the arrangement is. And I'll show you a picture of that in just a minute as well. Some birds have 3 functional toes, and in general, that's our running birds, our wading birds, and our swimming birds. So again, most parrots don't fit in this category. And then there's one species that has 2 toes. Does anybody know what that species is? It's kind of a quirky bird. And if you know the answer, you can put it in the chat.
It can take a minute sometimes for the chat to catch up.
I give you
emu, ostrich.
Yeah, so
cassowary.
The ostrich is the correct answer. It awkwardly has 2 toes, this dinosaur of a bird. So good job, chat. Now, in general, the structure of the feet, for all anatomy, but specifically since we're talking about feet, the structure of the feet, the arrangement of the toes is all based on function. So is this a woodpecker that climbs and spends a large majority of the time in the trees? Or is this a ground dwelling bird? Or, one of the birds that I work with, penguins, do they spend the majority of their time in the water, and their feet are going to be adapted to that? So I know this picture is very busy, but this just shows you a lot of the foot arrangements in birds. And I've highlighted our parrots with the red arrow. So they are zygodactyl, which means 2 toes forward and 2 toes backwards. And again, we number the toes from the inside to the outside. So this is 1, 2, 3, and 4. And that's more important for me when I'm talking about, in my exam notes. But you see here, there's such a wide variety of toe arrangements based on function with our awkward, with our awkward ostrich here at the bottom. Again, this is a zygodactyl foot here with 1, 2, 3, and 4 toes. And just kind of a quirky, interesting anatomic arrangement. So in each of the toes, you see here, there's 4 toes. They have tiny little bones that make up the toes called the phalanges. And birds have, when we number the phalanges, it's the number of the digit plus 1. So for our first digit here, it's going to have 2. For our second digit, it has 3. For our third digit, it has 4, and for our fourth digit, it has 5. So for me, when I'm taking X-rays, it's a little bit easier to figure out which digit I have on X-ray based on how many phalanges that digit has. So interesting bar trivia for you there. Now, birds don't have a whole lot to their feet. So we're going to go through some of the anatomical features of their feet. So these are pads. They have little fat bodies between the bones and the skin. So each one of these has a fat pad. And then over top of that, there are, of course, scales. And the scales vary in size and shape based on the species, like we talked about earlier. And then in each foot, it even varies in the bird. So in the sulcus, the scales are different than in the pad. And as you see in our bird here, in the pad, there's these tiny little round raised scales, and those are called papilla. And that's one thing we look for in our exam to make sure that the feet are normal. And I'll show you some abnormal pictures later. But those papilla do vary species to species. But in general, they should be nice and round and raised, unlike the crevices or the sulcus. Should have smoother scales so that they can bend easier. For example, our 2 birds here, so this is an eagle at the top. The eagle has very thick scales on the bottom of the feet with very prominent papilla on the pads. And you can ignore our lesion in the center right now. Whereas on the bottom, this is a penguin. These scales are very smooth and soft and flat. And because the eagle is meant for capturing prey items, whereas the penguin spends the majority of the time in the water. So we don't need rough, thick scales on the bottom of our feet for our penguins. There's also a claw with our birds that covers the last phalanx or the phalange, so the tip of the toe, just like most of our other species. This claw contains beta carotene and calcium salts, which comes into play when we talk about diseases that go along with the feet. It's important to have these components as part of your diet so you have normal health of your toenails. Now, the shape and length of your toenail depends on the use and the environment. So our eagle up here is going to have very long, very thick, very sharp claws, whereas our penguin down here is going to have short, flat claws. Now, because this bird is ground dwelling, the tips of her digits have curved sideways where they normally wouldn't. And then in general, all of the claws are continuously growing, with the dorsal surface of the top surface growing faster than the bottom of the bottom surface, so that way you get the curve in the toenail in most birds. Now, birds also need tendons to close and open their foot. They have flexor muscles that close the foot and extensor muscles that open the foot. Now, interestingly, in parrots, they've shown that there's a greater development of the extensor muscles, which again open the foot, to have increased dexterity in parrots, which when they're playing hard and picking up pieces of food and manipulating things with their feet that other species can't. I mean, if you can imagine using your feet to do what parrots do sometimes, it just it's not possible, at least for me. And then I want to show you this picture. There's a lot here, but want to show you that there's just not a whole lot to bird feet. There is bone, tendon, and then there's a vascular and a nervous supply, and then scales. There's not a whole lot of padding if the bird is injured. And then again, to show you that our flexor tendons run on the bottom and our extensor tendons run on the top, and that helps with opening and closing the toes. Now, function of the feet. I know this is a little bit intuitive, but for our ground dwelling birds, our birds that do walk a lot, we use the feet for movement, for perching, for feeding. You see the parrots that pick up food and eat, or the raptors that will catch their food, and then flight, taking off, and then landing. The feet are the landing pad and the takeoff spot. And then, I know you've seen with your parrots at home, the feet are important for preening, and part of the preening process. So I want to see at this point if anybody has any questions about anatomy before we go to the next portion. Yes, the eagle definitely had bumblefoot.
I don't see any other questions at this point.
Okay. Oh, and the reference text. And if you guys, so I do have a reference slide I did not include in this. So if you want a list of my references at the end, I can email that to whoever's interested as well. Okay, moving on. So this portion, so the captive care, the care of the feet, I am going to do a little bit superficially, because thankfully Phoenix Landing has a lot of really good resources about a lot of what I'm going to superficially touch on. So if you're more interested in things like diet, training, toys, things like that, then certainly check out the other webinars that Phoenix Landing has done. They also have a lot of really great books and toys in their shop. And then again, if you have any questions along the way, feel free to ask in the chat, and I'll answer at the end of this section. So feet, you don't think of feet care as much as things like feather care, but I would encourage that it's almost equally as important, because the feet have so much, it's so important for daily life. So, as with feathers, an appropriate diet for each species is so important in the health of the skin and health of the underlying structures in the feet. And that's twofold. So I want to make sure that the diet is nutritionally balanced to provide the nutrients for scales. Just like scales are part of the skin. So the skin does, it sheds, we form new skin. So it's always in a process of, cell death and cell regeneration. So if you don't have the nutrients to support that, then your scales are not going to be healthy. And I'm not going to go in depth into this, superficially. Nutritionally balanced is, ideally a portion of pellets in your diet. And then, the fresh fruits and vegetables and fresh foods. Then again, the Nourish to Flourish cookbook here is a great example of how to include those things in the diet. But where we see nutritional issues is primarily in birds with a seed diet, or those birds that are eating one or two things out of a seed diet and that's it. Or some of the homemade diets. Recently, I've seen a lot of nutrient deficiencies, if they're only feeding, grapes, cantaloupe, and broccoli, and that's all the bird is going to eat. The idea behind it is great. However, like a lot of our home cooked diets and other species, we want to make sure that they're balanced before feeding as the exclusive diet. Now, along with appropriate diet also becomes avoiding obesity. So, you may be feeding a very well-balanced diet, but if they're getting too many calories, then your bird is going to be fat. And we can also see feed issues because of that. Now, the other thing that I think is important for scale health specifically is water and humidity. We think of it a lot in our reptiles, but we don't pay as much attention in our birds. And I'll show you some pictures of this in a minute. And then outdoor UV exposure. Birds are not, not like some of the reptiles where they have to have UV light in order for health and function. However, I do think that they, skin health, feather health is better with outdoor exposure. And I'll leave it at that we could talk about UV light for about an hour. So I'll leave things there. And then appropriate perching. So offering a variety of perching diameters and texture. When it comes to perch diameter choice, you want majority of the weight balanced on the base of the foot, the whole foot, and the toes don't touch. So you don't want your bird's toes to be touching at the base of your perch, especially if it's a perch they sit on often. And then keeping the nails trimmed and offering grooming perches in order to help with the nail, keeping the nails short. Because if your nails are super long, that's also going to affect how your bird grips the perch. Now I'll put an asterisk on the grooming perches because it really depends on how heavy your bird is and how much they use the grooming perch. So I wouldn't have it be the primary perch in their sleep position, especially in heavy-bodied birds, because they can start developing foot lesions on the bottom. I do find these grooming perches really helpful for my small birds, especially birds that are really nervous about coming into the vet for nail trims. The lowest frequency of nail trims we can do if they're nervous coming into the vet, the better. But certainly most birds still need nail trims routinely. I like to train this behavior at home so that way I don't have to do it at the vet clinic because they don't love doing nail trims at the vet clinic. But I have one of my birds I can do it at home and one of my birds I can't. So keeping the nails trimmed, and no matter how you have to go about doing that, I think is important. And then enrichment, lastly, so foot toys, things for them to use their feet. Because if you think about in the wild, they use their feet all day long, flying and picking up food and finding food, foraging, climbing, digging, things like that. So the more active you can keep their feet, the better. And this includes, giving them things to climb on and giving them things that, if you can safely let them fly, that can be so helpful for health and joints. And I know a lot of us, if you have any experience with arthritis in humans, a lot of the research shows that the more active you are, the more stress you put on your joints, the healthier your joints are as you get older. So, even when you have arthritis, the more active you can keep your joints, the healthier they'll be as you age. So the same with our birds. If you've got a perch potato for 40 years, they are going to develop arthritis if they're not using those joints very often. So any questions about care?
Sorry. Oh, I was trying to answer something in the chat that I was moving to the Q&A. There was one question about whether or not some of that grungy, scaly stuff can fall off, especially if the diet is improved and then repair itself, or are they stuck with bad feet?
Yeah, I think just like, again, I think we know a lot about ourselves, just like human hair and nails, there is constantly a turnover of cells. And if you've got, historically a bad diet, crappy scales, eventually you're going to have regeneration and there is potential for regrowth and looking improved. I guess I'll put an asterisk on that if there's an injury there and scarring that you may not have normal, or if your anatomy is abnormal. So, things like arthritis, old injuries, you're not going to get normal, but if it's scales and ugly scales, which I'll show you some pictures of in a minute, we have lots of pictures of ugly scales, then yes, you could definitely get improvement with changes in their husbandry.
Several people are talking about rope perches, and I just want to take this opportunity to steer people towards our interior design class, which is on our past event page, where we talk about every, lots of texture, lots of shape, lots of sizes, but people are asking you about your view on rope perches.
Unfortunately, like Ann mentioned, I don't think there's a one size fit all. I think the rope perches, in addition to other perches, can be a fun enrichment tool. Especially the boingy type they're not necessarily perches, but the swings and things where they can hang on to, and it gives them better grip. I think it's great. One of my birds has a rope perch, the other one doesn't. Or for arthritic birds or older birds, I think it's less stress. It's easier to hold on to for the older birds. But I think included in a variety of perching substrates, I think, it can be a good tool. And all of these things are tools in our toolbox that I think you have to tailor to your individual bird. I've got a few really fat Amazon patients that can't have any of the rough abrasive grooming perches in their cage, or else they start developing foot lesions. We're working on the weight loss, but in the meantime, they can't have things like, the cement or the two-sided sanded or the lava rock type perches without developing foot lesions.
Yeah, those do tend to cause problems. We see that a lot too.
Mm-hmm.
Someone wanted to know about cutting the nails, and especially when a bird has completely black nails, and how can you see where the quick is, or can you?
Great. We should definitely do some sort of training on that as well. So I guess if you have a similar species with clear nails and you can put them side by side, it gives you a good judge. But you can't do a cockatiel to a macaw. There are some species that have a lot longer nails normally than others. So for me, when I'm doing the big birds and I'm using the Dremel, I usually will take it back. Take it back. And if I think I'm getting close, I watch the bird really closely, because if you're getting anywhere close that quick, they start getting really jumpy and agitated. And that's when I stop. I don't want to quick the bird, because then it gets to be a really negative experience. It makes the next time, harder. You can also look at, do this. So you can look at the nail bed. So the nail should form a almost complete rainbow. So if you go to the base of the toe pad and draw a straight line, you should have a rainbow. And in general, that's that tends to be a good way to look at how long their nails should normally be. And then you can judge again based on each individual bird. Now, if you're using nail trimmers for the tiny birds, you do have to be careful, but again, you can use that rainbow, the rainbow technique for your, you get a general idea. Or if you accidentally do cut one too short, that can be a good judge for the next time that, that is too short, and don't trim quite that far. Now, if you're using nail trimmers in general, just like the Dremel, if you squeeze a little bit before you cut, so again, sometimes the bird, if you're getting close, will start getting agitated, angry if you squeeze before you cut, if you're getting too close. So all these tools in our toolbox, but unfortunately, it's not a one size fit all for nail trim.
Can I jump in,
Mm-hmm.
Katherine?
This is Dr. Susan Orris, everyone.
Yeah, I think one thing that you're talking about the technicality of it, and it's really important. But the other aspect is that it's hard, and with a bird that is not trained to let you to work on the nails like that, it's really probably a two-person operation.
Yes.
Because it's not just the nail you have to be concerned about. You have to be concerned about the other foot and the legs, and you don't want to get a broken leg. So you have to move with them. And I've seen things go horribly wrong. So if you feel uncomfortable, that's why you need to take your bird to someone who is very good at it. And it really should be a two-person job. And if they're trying to do it one-handed, that's not the place to go, right?
Absolutely. Absolutely. Yes. I mean, in my lifetime of doing nails, I don't know if there's ever been a time where I've been like, oh yeah, I can do this by myself. Never. Even my
Never. Right.
Yeah,
right.
never.
Right. And the other thing is, just to kind of keep people forewarned, at one time I had a veterinarian come up to me. I had gone to get some dog drugs at the dog hospital, right? And I'm trying to make this clear. And they said, oh, Dr. O, you're the bird vet. And I go, yeah. Well, can you teach me how to do nails? And I said, no. I don't do dog nails. And I came to the dog vet for the dog meds. And you should tell them to come to me to do the nails, because it's not the same for every species, for every bird. Some birds have longer nails than others, like you said, and you need to look at that foot health. And there's so much involved, and you don't want to break a leg.
Absolutely.
So,
yeah. And
so
then
there you
I'll
go.
add in the stress response too, that,
Oh God, yes.
in order to do nail trims on a lot of birds, we do have to restrain them for it. And if you don't pay attention to the bird's stress level, then every time they come in, they're going to get more and more and more stressed. And you know, some of the smaller birds can have seizures with stress. So there
can
are
the big birds.
Yeah. Oh yeah.
And I had a green wing once. I had a green wing once that decided to bite its tongue partially off.
Oh no.
Yeah.
So those birds, we end up having to do, you know, anti-anxiety drugs before before something like a nail trim. And we're moving towards that in a lot of our cats and dogs, is do, you know, less stressful visits. And I think we're getting better in our birds. But it's not, unfortunately, just as simple, like Dr. Oros mentioned, of, you know, just doing a quick nail trim. Yeah, it's a lot goes into it.
It's never without some potential risk. And that's why I caution people, when they're going to do it, they really need to think through it, and they need to have a second person.
Yeah. And that's why I think, Phoenix Landing has some really good resources on behavior training. That, you know, if you can train, you know, even just basic wrapping in a towel, you know, doing the hugs in the towel, that helps us at the vet clinic. But then it's also a behavior you can train at home to do nail trims as well. And that way they don't have to come get stressed out and see me 3 or 4 times a year to get their nails done.
Thanks.
Awesome.
I think we'll save the other questions for later. Thank you.
Okay. Thanks, Dr. Oros. That was really helpful. And actually, this is my bird.
Jump in occasionally.
No, that's great. This is my bird in the picture, and I'll use her as an example because I am sometimes not a very compliant owner. So if you see her, let's see, can you guys see my pointer on the screen? Can you see this?
Yes.
Okay, so if you see her little middle nail here, it is too long. So if you kind of draw a line from her nail bed here out, I probably needed to have trimmed her nail there. So her toe is sitting abnormally on this flat shelf, and that nail is a little bit too long, as a great example of nail length. Okay, so I'm going to move on to some diseases if you guys don't have any more questions about anatomy. So, the first point we touched on with care is nutrition. So I'll show you some pictures of some sequela of poor nutrition, and I'm sure everybody has seen this at home, or has seen this in birds you've interacted with. So historically, we've always thought that it's, with poor diets, with seed-based diets, that it's low vitamin A. I think that it's probably a little bit more multifactorial than that, but that, in general, poor diets causes thickening or hyperkeratosis to the scales. But I'll also throw into this for the malnutrition, GI disease as well. So, the nutrients you take in are important, but also digestion and absorption of those nutrients are also just as important for using those nutrients. So in birds with really severe GI disease, we also do see some of these issues. So the hyperkeratosis or thickening the scales, really poor or retained sheds, abnormal nail growth, and then we see pododermatitis or bumblefoot to go along with malnutrition. Now I'll also add another disease onto here that we see that looks very similar to malnutrition. So with liver disease, the liver is also an important organ for taking the components in the diet and synthesizing them into things that make the nails and the scales. So if you have a liver that's not functioning normally or suboptimally, you can see some skin sequela of that. Now with both of these, you'll also see things like beak and feather abnormalities, but for this talk, we're going to talk about the feet. So you'll see on the picture at the top, this is a small bird with really thick, almost elephant scales. The nails are super long. They don't have the nice normal taper to it. And then you'll see, down here a little, extreme thickenings of the scales. And then this cockatiel on the bottom has some wear spots or some bumblefoot starting. And then the nails are a little thicker than they should be. And then there's lots of kind of flaky overgrowth of the scales. They don't have the nice normal papilla look to them. With some of our bigger birds, these are two of my favorite birds that we're trying to adjust some things. So this bird has these, normal scales on the top, but in between, the sulcus or the divot in between is kind of has that thickening to it, like it has two extra layers of scale. The scales are flaky and overgrown. And then on our bird friend over here, you can also see kind of a wear spot here that shouldn't be there. But again, just really thick, overgrown scales. They're not shedding normally. So this is kind of a few extreme examples of poor nutrition. And then of course, with both of these big birds, you can also see that their feather quality is not great either. But let's see. Now, in contrast, I think this can look very similar to nutritional deficiencies. This is my own bird again, and I am not always a compliant owner. So as you can see here, Penelope has normal scales here, nice, pretty round scales, raised scales with normal sulci in between, whereas she's got these really thick sheets of thickened shed scales. And this is because I don't give her baths nearly as often. With my 2 tiny kids and 3 full-time jobs, I neglect her showers sometimes. So she hasn't had a shower in a month or so. Her feet always give me away when she needs showers desperately. So this is her telling me that she needs some showers, which can mimic, again, nutritional deficiencies, but the underlying scale is normal. So once we humidify or moisturize her skin again, which I do exclusively with water, I don't add any sprays or oils or topicals, just showers, baths more frequently, her scales will shed normal after that. So the technical term for this is pododermatitis or inflammation in the feet. Also bumblefoot as well is the colloquial term for it. This in general starts out with just an increased wear on the bottom of the feet. So loss of normal papilla on the bottom of the feet, progresses to inflammation, and then can progress as severe as infection on the bottom of the feet. This, I've already mentioned it once, is multifactorial. And a lot of times it's more than one thing at once, not just one single thing. So obesity, inappropriate perching or substrate, malnutrition, lameness, and wounds. And it goes from, a mild redness and loss of papilla to, in severe cases, infection in the underlying joint, bone, tendon sheaths. And I've got, unfortunately, a lot of pictures of this. So this is mild bumblefoot. So you can see that there is a loss of kind of the normal pretty papilla in this bird. It's gotten smooth here and here. And then there's a little bit of pinkness to the bottom of the feet as well. So, not pink out here, starting to get pink through here. And then same in this bird. So loss of pigment, increased wear. This bird is starting to get a little lesion here. But this is a great time to intervene with bumblefoot. So in our parrots, a good time to take a look at the feet is when they're climbing or gripping onto the side of the cage. Look for any of this in our birds. And then, like I mentioned in the last slide, evaluate for, is my bird too fat? Do I need to change up the perching or substrate? Is there anything that needs to be adjusted in the diet? Or is my bird lame, and I'm missing that she's subtly lame, he or she is subtly lame and is putting more weight on one foot versus another. So that's a great time to intervene is here, because ultimately I don't have to be involved in that other than troubleshooting the things I just mentioned. Whereas when we get a little bit more severe, then, as a veterinarian, I have to start intervening. So this is a little bit more advanced bumblefoot. So you can see this lesion here, the foot pad here is smooth. There's a loss of that normal papilla. But thankfully this wound is still fairly superficial and dry. There's not a whole lot of swelling associated. On x-rays, there's no bone involvement. And same with this case here. And this is actually, full disclosure, a healing foot lesion. It was a lot worse than this before we started intervening. So it's flat, it's not swollen, there's no pain associated. And of course, this is a penguin, not a parrot, but and a chicken. So what we don't want to see is things progress to this. So this is really severe bumblefoot. And I guess I'll make a clarification. There is a bumblefoot grading system. I'm not going to go into that. And ultimately, it's probably not that important for our purposes here. But there is a classification scheme for bumblefoot. So this is really severe, really nasty bumblefoot. And again, this is 2 ducks and a bird of prey at the top. And as you can see, very, very large lesions, a lot of swelling, a lot of heat, a lot of pain. These birds hurt. They don't want to put a whole lot of weight on these feet. And this one up here, radiographically does have pretty severe bone infection underlying. And almost always when they progress to this severe, we have to do some sort of surgical intervention in order for this to heal. So we don't want to get here if we can help it. So, parrots, look at the feet. If you've got ducks and chickens, look at the feet. Anything that you can look at the feet before it progresses to this stage.
There's a question about what kinds of birds these are.
So 2 ducks, and this was, I think, a red shoulder hawk at the top.
Thanks.
Yeah. So another disease that we see really commonly in our parrots, I think it's underdiagnosed in a lot of our old birds because they're bipedal. So unless there's severe arthritis in one joint, then you're not going to see a whole lot of lameness. So what you will see potentially is, they go from using a lot of foot toys and climbing around a lot to just not as active. And this can be subtle, or they're not using their feet as often for things like for eating and play. And sometimes with severe cases, you'll see some joint thickening. But we see a lot of arthritis incidentally on x-rays when we're looking at other stuff. So this is a foundation bird here. And I know you guys don't look at a whole lot of, this one, normal x-rays, but in this bird, this is kind of a normal joint here. This bird, you don't see that normal joint, and it's got kind of these little pieces of bone here and inside the joint here. And it's not a regular smooth end of the bone. We call these little things here joint mice, but it's an indication of really severe arthritis. And I think this bird was lame, whereas this bird over here has a congenital disorder where it's lost some of its toe tips, and does walk a lot on the tips of the toes. So has developed, it's not a great x-ray, but has developed some thickenings on the end of the toes that likely are probably going to be uncomfortable as this bird ages. Now, this is another disease, thankfully, we don't see commonly, but is very, 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 very painful. So whereas bumblefoot, we can see birds that are acting normal, usually if they have gout, which is joint swelling, and the joint swelling contains something called a urate crystal. This is really painful condition. So usually they are uncomfortable, lame, fluffed. They look like they hurt. And usually in birds, this is associated with kidney disease or failure, unlike humans, where a lot of the human cases are diet related. That's not typically the case with our birds. But this is, as you can see in this bird here, there's some white swellings in the joints. This is a very painful condition that causes kind of that white discolored swelling. Trauma, we see it commonly, getting their toes stuck in toys, or friend biting, whether it's furred friend or feathered friend. For outdoor birds, bug bites or stings, constriction injuries, and self-injury. So this is a bird with a healing toe lesion from a constriction injury. Just to briefly mention some of the infections. So in our canaries, finches, and parakeets, there can be a mite associated with the scales that causes this, what you're seeing at the top picture here, this thick, flaky scales associated with the legs and the feet. A lot of times we do see some immune suppression with the scaly leg mites. The classic in my hands is the pet store canaries and finches that come in that, obviously are a little stressed with transport and being in store. Now, a lot of the wild birds, we see a virus called pox virus. It could also be seen in canaries as well, but causes these dry, thick lesions on the scaled areas of the feet as well. And these are usually dry, crusty things that, excuse me, come up and then go away. And I just want to put a little asterisk here. So we're talking about feet, we're talking about mobility. Other things that can cause lameness other than the feet directly are things like brain and spinal cord lesions. So, I'm sure everybody has heard about, spine injury or back injuries causing, paresis or loss of function in the back legs. Birds are the same. So they've got, brain and spinal cord just like everybody else. And if there's disease in either, that can cause issues with mobility in the legs. And then birds are cool with their anatomy. If there is kidney or gonad, whether that's ovary or testicular enlargement, with things like masses, one or both legs can have a paresis or paralysis. And this is because there are nerve plexus and pelvic nerves that go through this area. So kind of a quirky anatomical difference that other species don't have. There's not a whole lot of, there aren't other species that have lameness with kidney issues. So again, birds are cool. So that is all the content that I have. I know I breezed through a lot of those diseases. Again, we were just taking the tip of the iceberg. Does anybody have any specific questions?
Yes, we do have some questions, and maybe Dr. Orez would like to come on video also.
Yeah. Video. Okay, I'm on. Hi. It doesn't look the best. I was out driving my horse.
Yeah. Okay, I have a question. Sometimes we see birds that are picking at their feet and that later turns out to be heart disease?
Mhm.
Is that the most common reason that you see them feeling like their feet are agitated? And should people be aware of that so they know to get diagnostics like x-rays?
Yeah, that would have been a great one to include here.
It
Yes.
just seems that we're seeing it more and more these days as birds are succumbing to heart disease because of lack of exercise. I know that's Dr. Oroz's, pet peeve, but I just wondered if that is the primary reason, and if so, people should be aware of it. Is that, or are there other reasons they could be picking at the top of their feet?
Yeah, I would say, since you wanted me to say a little bit about that, never put something as the first thing. So it could be from heart disease. It could be that there's an allergic reaction. There could be a neuritis. And I don't know, Katherine, if you guys have this situation. It doesn't happen often, but I just have a situation with a sun conure, and I've had this happen a few times in my career. It always happens in the fall. It always happens to sun conures, and they'll start picking at the tips of their toes. So, and they're hard to deal with. There could be problems with the kidneys because the nerves to the legs go through the kidneys. I mean, there's a whole bunch of reasons.
Yes. Yeah.
But you guys are seeing more heart disease these days, and that's definitely one indication. I just want people to be attentive to that.
Yeah, and I think it's probably
it.
not that we're seeing it, we're probably just diagnosing it more often. I think it's on our radar more now.
Because I remember the first time it happened to one of our birds, I was shocked, actually. I didn't make that correlation between circulation and heart disease, and that was a symptom that we should have picked up on sooner.
Yeah.
Because medication makes all the difference in some cases.
Right. So you've brought up a really important point, Anne, and the point is that you didn't think about heart disease, and then why didn't you think that? Because I and Kevin Flammer, see, I'm a hell of a lot older than Katherine. So I and Kevin Flammer went around the country talking about how I'm going to tell you, this is an important thing. We went around the country telling people, well, if birds were hand raised, they were going to live longer. And both Kevin and I sat down at lunch before he retired, for God's sakes, and we both said we were wrong. And we were horribly wrong, because you take any bird and you sit them on a perch at about 15 to 20 years, they're going to start to fall apart. And what falls apart is their bones and their hearts, and other thing falls apart because of those two things typically. And so you didn't think your bird had a problem because you thought Susan had been right, that they were going to live a long time. So when they were turned about 15 to 16 or even 17, you thought, well, you never thought they were old. Well, I didn't think they were old either until we started really looking at this stuff. And my God, they just fall apart on us. So that's why at our next, retreat, we hopefully are going to talk a little bit more about flying. But I have to tell you, all you guys are watching, it was wrong. We thought one thing and we were wrong. And that's part of the reason we've gotten in the trap. And so a lot of veterinarians don't even know to think about it. Right. The vet, the dog and cat vet that does birds.
Right.
I'm a bird that does dogs and cats.
Do you guys have anything else you want to say on heart disease before I move on to another question? Anything
No,
else?
I mean, I think that it's just so hard with our patients that are showing us you know, a very non-specific sign. You know, I'm chewing on my toes, but you know, because they can't tell us, you know, why they're chewing on their toes, we have to do some tests and, you know, look into all these different causes. You know, we've listed just a few things for bad feet on the slide, but the list is extensive, and we may find that the bird has 2 or 3 different diseases going on at the same time that contribute. But then, you know, we don't always have great testing available for, you know, diagnosing things like heart disease or, you know, seeing subtle arthritis. You know, we miss a lot of the subtle arthritis on our X-rays. So it's, you know, the art of medicine sometimes is frustrating for clients and us. But unfortunately, you know, one thing doesn't mean that it has one thing.
And just to be clear with our listeners, blood work is not a way to diagnose arthritis or heart disease. You have to do radiographs.
Minimally.
Minimally.
Minimally X-rays, ultrasounds will look at the mechanics of the heart to see how well it's pumping and how well blood is flowing through it. If you were Scott Eccles, you would say you need a CT scan, for God's sake. So, you know, all roads from Scott's perspective leads to a CT scan. Not unjustifiably. It's a way to get at things that are much more subtle. And so one of the things, the flip side of the coin is, let's pretend that we've diagnosed heart disease and we put them on some heart medications. Often owners will say, gosh, my bird is more active. He's more like himself. He flies more. He doesn't get winded as often. And sometimes they're going to say something about the feet. It depends on the medication. We use medications to open up the blood supply to the feet. There's a couple of them that we try to use, and they may work, but they might take a while for that to really kick in. And that's kind of the problem with it, because we're not as fine-tuned as we would be with maybe a dog or a human. For sure, the human's going to be able to tell you if they got better blood flow to their feet.
Yeah, we have a cockatoo that's had to have several toes amputated because of them dying, basically. And we just recently changed medication, and it's a whole new bird, you know, finding the right medication.
For that patient.
For that patient, exactly.
Yeah.
Goal is to save those toes, the remaining toes. Okay, another question, and this is based on something we see a lot too, as we have an aging population entering our system for rehoming, as they all need homes at some point, usually. A lot of times, especially the macaws, the top of their feet are losing the scales. Is that a sign of age, or is that a sign of a particular medical condition? Is that something you see or have any thoughts on?
Like they're losing the pattern of scales on the top?
Yeah, like what should be all dark black, say, and a blue and gold is turning splotchy white.
They'll do that as they age.
So that's mostly an aging thing. Because, you know, a lot of times we don't know how old birds are. They've had several homes, and that information gets lost.
And so I would have said, like I said, you know, it could be, it's an aging thing. They're going to change color as they age. But we as veterinarians don't know enough yet if it's the consequence of what we've given as a diet, their lack of exercise, their heart performance. And Katherine, I missed the first little bit, but so the blood supply to the feet is pretty amazing. And honestly, we don't know as much about it as we should. When we get this dang book finished, there'll be some stuff in there. I just reviewed the first 5 chapters, but honey, there's 4 more. So the problem
Just
is,
talking about a new
what I'm saying
anatomy
is the
book.
publisher is slower than molasses in January.
But at least it's coming. So
Yeah, it's coming. So anyway, there are, and it also depends on species, but there's the blood supply to the feet, which is the arteries and the veins. And at some point, there are connections between the arterial side and the venous side. Now, those are called, anatomically, they're called vena comitatantes. But because of that, the blood vessels are going to, there's going to be some determination at some point somewhere up in the brain that I've got to rush blood over from the arterial side to the venous side and back up, and I'm going to make the feet be cooler, but I'm going to just supply just enough to keep the thing from dying. And that's why ducks can stand on ice and not have a problem. So they do some interesting thing with their blood supply. And that we have some of that, we'll show some of that in the book with the micro CTs that Scott has done. So we don't really know some of those answers yet, honestly. But, and so we crudely use things like isoxaprine and pentoxifylline to help them.
yeah. Yeah, I didn't go in a whole lot of depth about the vascular supply, but yeah, that's a good point.
A question, is bumblefoot the same as gout?
No. So two very different diseases. Gout is a, I'll go back to the slide, is an accumulation of uric acid crystals in the, never mind, in the joints, usually associated with kidney failure. Bumblefoot is an increased
sorry.
That's okay. Increased wear on the feet that can progress to infection as well. So two very different diseases. Usually because gout is so acute, we don't see it develop into bumblefoot, but theoretically, if you had chronic gout in one foot and not the other, you'd get bumblefoot on the opposite foot because the bird is shifting all its weight towards the more normal side. So they are different diseases, but they don't have to be mutually exclusive.
Somebody wants to know if the bumblefoot
I just wanted to
caused by bacteria and therefore needing antibiotics.
Yeah, okay. I'll just, one last thing about gout is when you see, that's called articular gout. In other words, gout is in something that you can see, like the feet or somewhere on the body surface of the bird. That's really painful.
Mm-hmm.
And that's the point where some decisions have to be made. Can we control the pain or not? I mean, those are really quality of life decisions that are tough.
Yeah.
In terms of bumblefoot, the pain, when I talk to human patients, my impression is that gout pain is really painful, and bumblefoot, while it's painful, it's not as painful as gout.
Yeah.
But that's a human thing. And bumblefoot is typically related to infections in the metatarsal pad or the feet, or some aspect of the digits.
So back to his question, if it's bumblefoot, do you have to use antibiotics because is it bacteria? I just want to be clear with our questioner.
Go ahead, Catherine.
Yeah, I mean, it depends. If you catch it in that mild stage where you can adjust and adjust your environment, then not necessarily. We don't want to if we don't have to. But if you catch it here, you can adjust some things, but if you get it here, then yes, you need antibiotics. If you have infection in the pads, then yes, you need antibiotics. But I think that's probably up to your veterinarians. Depends on what they're finding on the exam.
This is from someone overseas, maybe even a veterinarian. So that's why I wanted to make sure.
And again, remember, we talked about the blood supply.
Mm-hmm. He just wanted to know if antibiotics were required. Yeah, since it was a bacterial.
So using antibiotics, but you might not be getting them to this point down here on that that's called the metatarsal pad. Katherine, you can just point out a metatarsal pad for them. And so, so you might have to do something local, which is a common thing that falconers will do, or falconry veterinarians. They'll use antibiotics locally. They have different ways of doing that.
Birds are cool, but they are difficult.
Harder, much harder than humans.
Yes. And even dogs and cats, I think, as a general veterinarian, sometimes I like the dogs and cats sometimes because it's very straightforward. But when it comes to the birds, I think that's why not a whole lot of veterinarians enjoy doing birds, is it can be a very difficult job sometimes.
We have some very kind of basic questions here too. Can birds get fleas?
No, thankfully.
What is your recommended treatment options for arthritis?
Oh, I think that goes with Bumblefoot. It depends.
It depends.
Everybody loves to hear that. I mean, I think it's like, again, Bumblefoot or, a lot of the other bird diseases, you have to address the environment and the world they live in, and as well as medicating the bird. So it's not always just a pill. It can be a pill, but a lot of times it's adjusting the perching and adjusting the cage. You can use things like dogs and cats, like a glucosamine supplement with mild arthritis. But then we've got a few things in our arsenal that decrease inflammation and provide for some chronic pain management too. But what that looks like depends on the age of the bird, the chronicity of the pain, the severity of the pain. Yeah, so we've got a bunch in our toolbox, but it just depends on each bird patient.
Is more activity good too? Just like
more activity is good.
Activity.
And the other thing I would say is remember nutrition.
Mm-hmm.
Because just balancing those omega fatty acids and making sure you have adequate levels of vitamin A and beta carotene, which you can get with between pellets. I'm a Nutriberry girl, and a long time ago, it took me, 25 years of whining at Dr. Lefebvre to say, I would like to have a senior Nutriberry. and then I had to make them it took about 20 years. And then I had, well, what do you want in it, Oris? And so it has, this isn't a plug for Ted, it's just a plug for old birds. It has a glucosamine and chondroitin in it. It's balanced omega fatty acids, and it has milk thistle, dandelion, and ginger, all good for those types of problems in some older birds. Mm-hmm. So it took me about 20 years to get him to make those. but people do find, that it does help them when. Yeah, that's one way of getting, those nutraceuticals and herbals into them.
Yeah, it's a great point. Getting them to take things like that is hard. So that's a great.
It's hard. It's hard.
No and then also along the same route as nutrition is avoiding obesity. I think we've got a lot of data in dogs to show that, a 10-15% weight loss is the same as using a daily anti-inflammatory. So, getting your birds to ideal body condition with the activity and diet I think is important too for arthritis.
Yeah. And I saw the thing, Katherine, you might know the answer to this because I don't know the answer. Is somebody asked about black cherry juice. Although I do a lot of herbal medicine, I do know that cherry wood is toxic to animals, but I don't know about black cherry juice. I know people do it for arthritis because I take some myself, but I really don't know.
Yeah,
I think it would be okay.
That does the nutraceutical, so I'd have to ask her.
cherry
Yeah.
juice is great for uric acid and kidneys.
Right,
Also.
but
Yeah.
I don't know if, I know you can certainly give them a little because birds will feed on cherries, obviously not the cherry pit, right?
Mhm.
Because that's a problem. But I don't know when they make this juice, that you buy commercially. I don't know,
Yeah.
could there be a little bit of the cherry pit stuff in there that
Yeah,
they
for
crush?
those that don't know, it contains cyanide, so you don't want to feed those to your pet.
Right. Right.
The pit.
And I'm glad you brought up diet because as someone personally prone to arthritis, I know that cutting carbs out of my diet changes my body reaction completely. And so many people give their birds pasta, pizza, toast, all kinds of things that probably accelerate arthritis. So yeah, so diet.
Yeah.
Yeah, somebody said something about pomegranate juice, and pomegranate's great.
Mhm.
Mhm.
I do know that would be good.
There have been several people who have asked about chewing on toes, and I can just say from a macaw person's perspective, that's often nerves. Yeah. But what do you guys think about?
And grays.
And grays,
Grays do.
yeah. Yeah, when they're uncomfortable.
Mhm.
Mhm. Are there other reasons?
I think a lot of that is related to stress.
Yes,
Yeah.
I agree.
And I saw a good question about when is the parrot technically a senior?
Right.
Oh,
I thought that was a good question. It really depends on the species. So, our smaller birds age quicker than our bigger birds. But, like Dr. Oros mentioned, we may need to classify them as senior before we typically have classified them as senior. So instead, I used to think, 30, 40 was a senior bird, but now I might need to adjust that a little bit and get them in more frequently. But
yeah, by 20, most birds are starting to fall apart if they don't fly.
yeah.
Mhm.
And the little birds, what would you say for senior?
Well, cockatiels,
Mhm.
they start looking older about 16ish, 17, somewhere in that range, if they've been on a good quality diet, like a pellet or a NutriBerry or something like that. They get older faster, and then you got the parakeet, right? And the parakeets, they've got to get through that period between 3 and 5.
Mhm.
And if they make it past the 5-year mark, then with a good quality diet, they go on to about 10. I've seen some of them at 15ish.
Wow.
But and the 15-year-old birds were flying a lot every day.
So I know another very cloudy answer to a specific question. Welcome to birds.
Yeah. Well, because we're not dealing with, and that's an important point. We're not dealing with dog. We're dealing with species. There's only one species when we're talking dog, or one species when we're talking cat, but we're talking a whole variety of species, literally from all over the world.
Mhm.
And it's back in the day when Katherine, when you weren't even born yet, and I was doing bird medicine. We started, and the model was a chicken.
Mhm.
And then it was the blue-fronted Amazon. And then, and now we're learning all these nuances, but we're still at a very young age of that.
Yeah.
It's come up several times about things to put on the feet. I know, many years gone by, a lot of people talked about putting coconut oil or lotion or aloe vera, but at one point in the talk, Dr. Baine, you mentioned not doing anything like that. So could you address that again?
Yeah. So unless there's a specific disease we need to address, I think most birds just showers, baths, whatever, however they want to, take their grooming frequently is the most important, because in the wild they're going to be getting rained on. They're not going to have little aloe vera, rubs for their feet. And for your birds that like to pay attention to their feet, adding something topically, I think, makes them pay more attention to their feet. So you wouldn't, moisturize a bearded dragon. I don't think we need to moisturize our birds' feet either. Just more frequent showers, as evidenced by my bird in the screen in the slideshow.
Okay. Let's see. Leg bands. What's your view on leg bands and the effect on feet or legs?
Depends if they're put on right.
Yeah, I leave them alone. I leave them alone if they're put on correctly. They can be an identifier, although it's not a universal banding system for the most part. But
right, but still, technically, in terms of a USDA ban, technically, the government says it should not be removed.
Are you talking about the wild caught open bands?
Yeah.
Yeah, we never remove those either. Those wild caught.
I call them bracelets, but I talk about them as bracelets. I try to keep them on. I used to cut them off all the time, but honestly, it's just like trying to do nail trimming in birds. Cutting off a band, you gotta really know what you're doing, and it's a couple people operation, because you can break the leg. And in the case of a band that's too tight, just so people understand this, back in the day, 37 years ago, I said, man, this band is way too tight on this canary. And when I took that band off, the rest of the leg came off.
Yeah, I've had the same experience. It was a humbling process. Yeah.
Humbling, let me tell you. So you got to be ready, and you got to know what the heck you're doing when you take that band off. And you got to have the right stuff. I mean, I've had situations where the band is so strong, I cannot get it off with anything that I have.
Yeah. So it doesn't come without risk to remove bands. And if it's not causing a problem, we leave it alone.
And for the record, can you tell people where the band is supposed to be? Because sometimes it's in the wrong place.
Yeah, it's a great point. Let's see if I can find a
metatarsal area.
Let me find a picture.
You don't want it above the hock. You want it below the hock, between the hock and the foot.
There we go.
If you all know where that is.
There it is.
Yep.
So foot, hock, and right in between. So Penelope would probably be a better example here. So right here, right in the middle, between the foot and the hock up here. So here.
Not on the ankle, so to speak.
A bracelet. Yes, an anklet.
An anklet.
Yeah. Every now and then we see them higher up on the leg, and that's definitely
bad.
Bad.
That's where they can get a lot of constriction in a parrot.
Yeah.
Yeah. Or if they're too loose and slide up there and then get stuck.
Someone wanted to know if you see heart and circulation issues in poultry the same way we see them in parrots.
Yes.
Yes. Especially our broiler or our meat-based breeds. I mean, they all have heart disease unless they die. Yes. Yeah.
Turkeys.
Yes.
Why? Because they're not given activity, or
no? Because they were pre-programmed to die at a certain age, because that's what they're designed to be eaten.
Yes. So genetics. And yeah, I mean, yeah. Some of our layer hens, we do see heart disease as well, but it's not as common as the breeds that were made to grow them up and eat them pretty quick. And broiler chickens.
What do you think about vet wrap on perches and stuff? There seems to be a lot of people using vet wrap. It's not something we do very often, but we have birds that come to us all the time, and people put vet wrap on every perch, and I'm like, why? What's the point of that? They have toes. Yeah.
I think it's a tool in the toolbox. It can add some extra padding for the arthritic birds and some grip. It's got kind of that sticky texture to it. So for the birds that don't like the rope perches or destroy the rope perches, or they only like brown perches, that can be a good thing to put on the perches. Or if they're not adaptable to the flat perches, if they've got arthritis.
Someone just asked about sandpaper perches. That, I have to tell you, that is a pet peeve along with the little thing for mite protection.
Mite protectors, yes.
Yeah.
Those are the two that
Yeah.
I thought that by now, 37 years later, we would have gotten rid of that crap.
100%.
They're obviously still making money off of it at the pet stores,
As soon as they come into the exam room with them in the cage, I throw them out in the trash can.
Yeah. So that's why I tell people that's where they belong.
Yes.
And I say to them, they go, wow, it's supposed to sharpen their nails. And then I say, okay, let's look at the bird. And let's look at where the nails are. Are they anywhere near the sandpaper? All you're doing is sanding off the bottoms of their feet. See, when I'm old like this, I tell them. So do you want to take sandpaper and go like this on the palms of your hands?
That's
well,
a good
hell
demo.
no.
Yeah, really good demo. Yeah.
So it's awful. I mean, it should be banned.
Yeah, and I guess on the same avenue, I'll put a plug in, to avoid the wooden dowel perches as well that come with all the cages. Go ahead and throw them out with the cage when it comes to you, and replace it with other perches. So no sandpaper, no wooden dowel.
Well, and the other one that gets me are manzanita perches. You didn't say anything, Catherine, about those. Those are slippery, so that we slip the poop off. Well, okay, what about, how does the bird feel? Let's be on a slippery surface all the time.
Good point.
Right?
Yeah.
I mean, like, are you thinking?
Yeah, so we end up doing natural perches, like someone in the chat mentioned. I think Phoenix Landing has some resources to show how to disinfect the perches. You don't want to transmit wild bird diseases to your parrots. But yeah, natural.
And I think you're overdoing that. Just cut the darn piece of wood out, this fresh branch, and throw it in the cage.
Mine. I have to say, I don't wash mine.
No. What wild bird does you think you're going to get paramyxovirus? Probably not. Or West Nile from the perch?
Good point. Well, just make sure it's not loaded with bird poop. How about that?
Yeah.
Well, okay. If there probably isn't going to be bird poop on it. But if it was, just don't use that perch. Mm-hmm. But the thing is, the people need to understand is that outer cambium layer of the branch is nice and soft on the foot. That's what birds were designed to stand on. And so at about, depending on the humidity, that is going to dry up. Right? So it's going to take 2 weeks to a month, depending on what time of year and all that other stuff. And so then this is what I tell people, you throw that out of the cage, put it in your compost pile, go over there and, cut some new pieces of wood and throw that into the cage again. And you're constantly turning over your perches. That's also important for the feet. Right. Because the size is never the same, which is because it isn't the same in the wild.
Yeah.
Yeah, on our enrichment link, I think you can find a lot of plant information about what's safe and not safe. And there's one site we always recommend, MD Baine. He's got a lot of great detail, and that link is there too. Which leads me to, I remember at one of the vet conferences, somebody from UC Davis gave a talk on pellet size, and she called it podomandibuation. She said she always recommended bigger pellets so the birds could pick them up, like nutriberries would be. And a lot of times we get birds and they come with these little tiny pellets, and I'm like, why aren't you using bigger ones? Because even the little birds like to pick up. And exercise their feet, right? So you have any
Right,
pellet
so,
thoughts?
well, yeah, first of all, my pellet thought is, it depends on the bird. Because if you notice, cockatoos like small pellets,
They
because
do.
they're into manipulating the small thing. And they're more into the pellet with their beaks.
Hmm.
But the South American species are more into manipulating the food item with their feet. Have you noticed that?
Mhm.
So I like big chunks of things for them to chew on, and put them all around in the cage, so they've got to work to get to them.
Yeah.
Fly would be better, and flying from place to
Flying.
place to get to
Yes,
their
yes.
food.
She never
Which
hesitates
is,
to remind us all about
I
exercise.
don't.
Yeah.
Yeah, right.
We're all looking for more ideas so we can create that exercise class, but there's just so few really
I
good
know.
options.
I
Yeah.
know.
It's a good reason to
So-
have smaller birds that can fly around your house more safely. I mean, I don't want to encourage my 4 macaws to all be flying around the house. So, I mean, yeah.
You'll need to build them a
You
long
do
wind
the best.
tunnel.
You do the best you can do with what you've got.
That's right.
Right.
That's right. Somebody wanted to know, what about areas that have cryptococcus? Is that an issue?
No,
Okay, good.
just put the damn perches in there.
Some of my favorites are roses of Sharon and dogwood. Roses of Sharon make great butterfly bush. Some simple things that we have in our own backyard, as long as they're not
That's a
sprayed.
good idea. Yeah, that's a
Mhm.
great idea.
We're up by us. One thing that we have, 2 kind of wild shrubs. We have gray dogwood. We don't have your dogwood, but we have gray dogwood, and we have autumn olive. And my birds get autumn olive all the time, branches. The problem with pine is the sap.
Yeah, you don't want to use pine.
Yeah, so that's a
Mhm.
problem. And you don't want to use maple.
Yeah, that MD Vaden site, I think Cassie, thank you, Cassie, for putting that in the chat.
Yeah.
Is a link for everybody to go to.
And walnut, you don't want, walnuts, another walnut, cherry, maple are the 3 big ones you don't want to use.
Yeah. I like the roses of Sharon because when they bloom with these beautiful big pink flowers, the birds love the flowers too, so they like
I don't
peel
have
off the
roses of
bark,
Sharon.
perch on it, and eat the flowers. It's all good.
All
Package
good.
deal. Okay, so I think we've hit most of the high points here, unless you guys are aware of some other questions that we need to bring up. Any closing thoughts, Dr. Baine? Thank you for your time and effort in putting this together today.
Absolutely. Yeah, hopefully everybody will start looking at their birds' feet now.
Yes. And get ahead of the problem.
Yes.
Yep. Yeah. Any other thoughts, Dr. Orris? Any closing?
I think that this was a really great lecture where, I don't know how many people you had, but as Dr. Baine was saying, that we need to look at things more closely, and you as an owner need to think through some of these things, and ask yourself, does it make sense? And the same thing for us as veterinarians. Does it make sense? And that's why people like Dr. Baine and I go to conferences and talk to each other and all that. That's the kind of veterinarian you want to look for, because things are changing. And because, we know so little about our wonderful feathered friends. And by talking to each other and learning more, we come up with new ideas of how to take care of them better. And because we're stewards for these wonderful creatures, we have a tremendous responsibility for them. And so it's just wonderful that all of you came on today to listen to about something like feet on a Sunday around Christmas, for God's sakes. So
Yeah, there were a
hats
few people
off.
going to Christmas parties who are
Yeah,
glad it's being
well,
recorded. Yeah.
well, hats off to all of you for coming on and learning and wanting to listen. I just want to thank all of you.
And this is a good time to remind people that we are really hoping to have our retreat in Asheville again this year, COVID allowing, June 4th and 5th. So pencil that in. Our next event by Zoom is January 8th, where we're going to talk about conservation in Bonaire, and not just the Amazons there, but other species as well. And in February, we're going to talk about beaks. We're going to go to the other end of the anatomy. So that should be really interesting too with Dr. Murphy. So we hope you'll come back for our winter and spring Zoom events. And then I really hope you'll consider joining us in Asheville for what is always a really fun weekend over 2 days with a lot of topics from easy and fun to deep and medical. So something for everybody, and just a good time to network and be together. So we're hoping that that is finally going to be possible. So thank both of our wonderful veterinarians for being here today, also on a Sunday.
Thanks for joining us, Dr.
Because we
Oros.
know you work hard during the week. So thank you.
I had a great time. You know how I love to just listen in.
Bird
I'm always
break.
learning. See, I'm always learning.
All right. Thanks, everybody. I hope to see you back with us on January 8th. Meanwhile, have great holidays. Stay safe.
And
do
have
something
a
extra for your
happy
bird.
and healthy holiday.
Yep. Go look at your bird's feet and make sure everything's in order. All right. Thanks again. Talk to everybody soon. Bye.